And welcome back mga champions. Ito ang episode 4 ng MH Talks na ginawa ng #MentalHealthPH kasama ang The Medical City Department of Psychiatry. Ang topic natin ngayon ay supporting our frontline workers sa panahon ng COVID-19. Ang ating susunod na guest ay nagtapos ng kanyang medisina sa University of Santo Tomas noong 1985 at nag-residency sa adult psychiatry sa The Medical City. Naging president siya ng Philippine Psychiatric Association mula 2008 hanggang 2009 at kasalukuyang nagtuturo siya sa 3 medical schools, Angeles University Foundation, Manila Central University at Chinese General Hospital. Since 2011, siya din ang chair ng Department of Psychiatry sa The Medical City. Champions, please welcome Dr. Maria Imelda Batar. Hi, Doc.
Good afternoon.
Ayan, good afternoon, Doc. Now, Doc, we have some questions po about how we are going to focus or attack this pandemic kasama ng ating mga frontline workers. Now, Doc, ano po yung po pwedeng gawin ng ating mga healthcare workers or ng mga frontliners natin to deal with these feelings of exhaustion mentally and physically? At parang what I'm getting from them is sobrang pagod lang talaga at yung emotional heaviness ng kada duty nila, parang nababurn out na rin sila. Kasi just like what Dr. Jimenez told us, parang times 4 po siya ng burden from an ordinary emergency department day. So, paano po ba, Doc?
Okay. Alam mo, nabanggit din ni Doktora kanina, no? At kailangan siguro paalalahanan natin ang sarili natin. Ang mga tinatawag natin mga modern day heroes ay actually mga tao. Mga tao din sila, na doon sa kauna-unahang lecture, di ba? So, meron ding mga iba, ang manifestation ng kanilang emotional response is anger. No?
Mm-hmm.
At meron din tayong pakiramdam na we are so powerless, no? Dito sa sitwasyon na ito. Dahil unang-una sinabi nga natin na itong virus na to, hindi natin kilala ito eh. No?
Yes.
Sabi ni Doktora, wala pa kasi talagang mga evidence-based na diagnostics as well as therapeutics, no?
Mm-hmm.
So, napakaraming uncertainties nga, no? Itong mga frontliners natin are modern-day heroes. Wala naman silang mga superpowers, no?
Yes.
Wala naman silang Superman, Wonder Woman, no? So, meron din silang mga emotional responses. Meron din silang mga vulnerabilities. Napapagod din sila. And in particular, ang isang problem natin, dahil nga wala pang definitive na therapeutic regimen, no? Wala tayong alam na siguradong preventive mechanisms.
Mm-hmm.
Kulang ang armas.
Yes.
So parang isang soldier, pinapunta mo sa frontline, sa gera, ang dala-dala lang niya, pistol.
Mm-hmm.
Ang kalaban niya, 100. Diba? So kulang talaga yung armas. So na-encourage nun yung fear natin. No? So ganun din sila, na-encourage din yung fear nila. Tapos, ano yan eh, kasi parang sabihin natin, bakit parang mas pagod na pagod sila at the end of the day? No? Maliban doon sa sinabi ni Doktora na talaga namang times 4 ang bulk ng kanilang mga pasyente, parang pwede nating i-parallel yon sa isang team game. Sa isang competition, no? O nagba-basketball ka, o nagba-volleyball ka, nananalo kayo. So, syempre, pag nananalo kayo, parang pagkatapos ng game, parang kaya mo pang mag-another set, another marker, no? Pero pag natatalo kayo, hindi ka. Parang talagang pagod na pagod ka. Eh, sa ngayon, parang ganun ang impression ng mga tao, di ba? Medyo tayo ngayon eh. Kaya talagang parang emotionally exhausted ang mga frontliners.
Now, Doc, ano yung pwede nilang gawin po doon? Kasi parang aside from the fact that they already acknowledge the idea na, okay, we are feeling this fear, we are feeling this emotional heaviness. Now, how do they condition themselves na paano pa sila magko-continue dun sa ginagawa nila?
First of all, syempre sabi ko nga medyo dehado tayo, no? Mm-hmm. Pero importante din na we look at things realistically.
Yes.
Hindi naman lahat ng tumatay. 80% ng COVID positive ay actually nagre-recover. So if we constantly look at the 20% na nagiging critically ill, or even those who eventually die, talagang malulugmok tayo. But if we look at the 80% of people who recover, we look at things more realistically. And ang importante din kasi, sabi ko kanina, no, they are modern day heroes, not because they have superpowers, but because physicians and people in healthcare usually are armed with specific qualities, no? First quality, of course, yung bravery, no?
Yes.
Second quality, yung idealism nila, no? So they will really go at full length, no, to give the best quality healthcare, no. Yung imperturbability, that's one of my favorite terms, no, to describe.
Ano ba yun?
Ibig sabihin nun yung calmness mo in the midst of panic, diba? In the midst of a crisis situation, you remain calm and you're still able to think through the problem. Okay. And then yung pagiging altruistic, no? Sabihin nun, you are other-centered, no? Yun nga lang, minsan, masyado tayong other-centered, nakakalimutan natin ang sarili natin. So in terms of coping with a crisis like this, or in other crises for that matter, yung self-care is very important. No? So ano yung mga self-care tips na yun, di ba? Simple lang, di ba? Adequate sleep, food, actually being able to talk about your problems with somebody is a very good self-care mode, no? So na-mention last time Dr. Cleto, yung mindfulness, stress reduction, no? That's actually very effective, no? In terms of being able to control how you react to a crisis which you could not otherwise control. Diba? You cannot control a crisis, but you can control how you react to a crisis.
Ayun. So, gusto ko lang po i-highlight yung sinabi niyong word kanina that was really enlightening for me. That is imperturbability, or the ability for you not to be agitated agad or parang to grace under pressure. Now, I believe, Doc, na parang malilink natin to with our other episodes nga na parang more of mindfulness will really highlight your ability to be calm in these situations, for you to focus at the present and not really entertain the fear right after. Ayan. Doc, ngayon ito po yung isang dilemma din po ng ating healthcare workers or ng ating mga frontliners. Paano naman po yung mental at emotional burden kapag kailangan nilang gumawa ng difficult na decisions? Kasi halimbawa, kung kulang po talaga sa gamit, sino po yung dapat nilang unahin? Ano po yung maaaring masabi natin sa kanila? Parang magiging advice po natin sa kanila when making these decisions?
Alam mo, ako personally, noong nakikita ko na at nababalitaan ko na yung nangyayari sa Italy, no? Choose kung sinong 40-year-old ang bibigyan ng ventilator. No? Kumbaga, 40 years old, yung isa may asawa, may anak, yung isa single, ganun. That's a very difficult decision to make because it's actually bordering on the ethical and moral.
Yes po.
So, ano yung support natin doon? Kailangan natin, maliban sa personal support natin, is an institutional support. No? So, Paula Jimenez earlier mentioned about the provision for PPEs, provision for accommodations and transportation. But apart from that, as a manager and as a leader of an institution, you should have certain protocols, guidelines in place. No? And that's something that Medical City had started to do less than 2 weeks ago. So that, kung nakasulat dun sa protocol, ito yung mga presentations, ito yung mga manifestations, ito yung life circumstance ng patient na ito, dito namin ibibigay yung ventilator. So hindi na dun sa frontliner nakasalalay yung decision.
Okay.
Diba? Such that because there are protocols and guidelines, then certain decisions are not personal decisions of the frontliner. So they are institutional decisions.
Mhm. Ayan. Now, Doc, shifting naman po from our frontliners, now let's move to our loved ones or yung loved ones ng ating frontliners. Kasi I believe the toll in this pandemic is not only focused on our frontliners but also the people who are surrounding them. Now, Doc, paano naman po natin maiiwasan yung kaba or yung takot or yung nararamdaman nating paranoia to when it comes to our frontliners? Kasi I believe there are some incidences na mention nga rin po ni Dr. Jimenez na may iba pong mga frontliners natin na naka-experience po ng discrimination during their duties. Actually, hindi nga po during kasi parang before pa or after their duties. According to Dr. Jimenez, in the medical city, some of the staff are not being allowed to go home. Actually, hindi sila, allowed silang umuwi, but then yung mga inuwian nilang mga rinirentahang places, ayaw sila tanggapin. Now, meron din mga cases back in parang 2 weeks ago, I think, na may binuhusan ng bleach, meron pong hindi ine-entertain kasi nalaman na healthcare workers sila, and some people even comment on social media na wag na daw pong parang papasukin yung mga healthcare workers sa supermarket kapag parang wag daw sila i-prioritize. During duty na lang daw sila mamili. Now, Doc, ano po yung pwede natin gawin as mga relatives or loved ones itong mga frontliners? Kasi syempre may kaba rin tayo para sa kanila.
Okay. Diba na-mention ko kanina yung support systems, no?
Mm-hmm.
Yung first support is on a personal level. The second support is on an institutional level. Tapos yung third support is on a community level. Okay. So supposedly, the communities should provide a safe environment, a quiet environment. Quiet, I mean, kung gusto magpahinga itong healthcare worker na ito, papahingahin natin sa kanyang bahay. Kung pwedeng hindi mo na mag-cellphone, no, para hindi siya nakakakuha ng so much negative energies from people who post useless or even fake news, no. But I think also the reason why some members of our community react in a particular way is because there are, sinasabi namin, 4 ways by which we cope with any crisis, no? Ito yung 4 na F. Mm-hmm. So, siguro, Naiko, alam mo na to, yung fight and flight. Diba?
Yes.
Tuturo yan sa med school. Okay. So, may fight, may flight, merong freeze, at merong face. Mm-hmm. So, yung fight, nandun yung aggression.
Yes.
So I think some people in our community have been infected with what I call a virus of ignorance and a virus of antipathy. No? Hindi nila ma-realize na the reason why they are reacting with such aggression is because they are also afraid. Underneath that anger is so much fear also. Kaya lang ang presentation, may aggression. No?
Yes.
And bakit towards the healthcare worker? Kasi parang naghahanap ka ng focus ng iyong worker. No? It just so happens, itong mga healthcare workers natin, yung mga frontliners natin, are the people who siguro are the closest thing to the virus.
Yes po. Siyempre, harap eh.
Ako ang assessment ko doon, galit sila doon sa virus. Just as lahat tayo galit doon sa virus. Pero ang expression ng kanilang reaction, ng takot nila is galit instead na compassion.
Now, Doc, speaking of aggression, paano po pag dumating na doon sa point wherein inside the family, yung mga mismong family members natin, sila na po yung medyo nang-discriminate sa ating mga frontline workers and parang sila na po mismo yung may gustong parang itakwil sila. Kasi yun nga, parang meron silang galit doon sa virus and hindi lang maiwasan na isipin na baka may dala ka kasi, baka pagpasok mo dito sa bahay, kami naman yung mahawa. So, ano po yung pwede nating gawin pag gano'n?
Alam nyo, kung kayo yung family member, kung yung kasama sa bahay ng healthcare worker, let me tell you, kahit yung healthcare worker, takot na takot din.
Mhm.
Takot na takot din silang ma-infect. Takot na takot din silang maka-infect. No? Kaya nga isa dun sa mga institutional supports na dapat ginawa ng mga hospitals, no? Whether private or public, is tinuruan itong mga healthcare workers kung paano magsuot at kung paano magtanggal ng mga personal equipments. At siniseryoso talaga ng mga HCWs yun.
Yes.
Kasi ang nalalay doon, hindi lang yung kalusugan nila, pero pati kalusugan ng mga kasama
Yung mga
nila.
tao sa paligid.
At pati lahat ng nakakasalimuhan nila.
Yes
no?
po.
So iniisip po namin yun. Huwag niyo pong isipin na hindi namin naiisip yon dahil naiisip talaga yon ng mga healthcare workers. So the most that we can tell them is just to remind them, no? Huwag kang susugod pag wala kang PPE.
Yes.
Take care of your health, no? No. So instead na being angry, no, let us tell them that we are actually concerned about their welfare. We're actually concerned about our welfare also.
Okay. So parang it's more of conditioning na it's not towards the anger towards that particular frontliner or dun sa coronavirus itself. But then, kailangan mo ipakita yung concern mo na kasi maaaring ganito yung maging epekto niya. It's more of being calm and facing this pandemic. Now, Doc,
Rico, mabanggit ko lang, kasi sinabi ko nga, itong mga different levels of support, di ba? Kasi we are all part of one team.
Yes.
So as community members, as family members of a frontliner, pati yung mga police, yung mga barangay tanod, barangay officials, ang DOH, ang Bureau of Customs, ang FDA, all of us are part of one big team, no?
Yes po.
This is the biggest team that has ever been created, no? Because it's the entire world, no? That's part of this big team, no? So let us do our part. Sabi nga ni Dr. Jimenez, no? Let us do our part, no? Each one has a role in that team, no?
Yes po. Ayun, kasi di ba yung iba rin po parang they experience this certain kind of parang inadequacy because they only stay inside their homes. But then hindi po natin na highlight. We are also doing our part by just staying at our homes, washing our hands. Kahit na small lang po yan, isang malaking tulong na rin po ito sa pagsugpo natin sa COVID-19. Hindi lamang po basta-basta frontliners lamang yung lumalaban para dito. Tayong lahat po may naitutulong din dito.
Yes.
Ayan, Doc, ito naman po.
Which is why I remember, kasi early on in the fight against COVID, parati nating hinighlight ng ating mga HCWs, ang ating frontliners.
Yes po.
Middle of the game, somebody tried to reverse that, to change that into a statement which read like, our HCWs are our second line of defense. Our community is our first line. Diba? I think for everybody's sake, I think we should start mouthing that, no? Na tayo, kahit nasa bahay ka, tayo ang first line of defense, yung nasa bahay. Lahat ng mga nagtatrabaho sa community, nagpapapila sa labas ng grocery o sa labas ng drugstore.
That's true.
Nag-make sure na yung mga walang barangay pass ay hindi lalabas, na yung ating mga matatanda at yung mga vulnerable population ay nasa kanilang mga bahay at safe. Yun ang first line.
That's true.
No? Ang mga doktor, ang mga nurse, ang second line of defense.
Kumbaga sa prevention perspective or sa preventive medicine, nandun tayo sa part na tayo nagpe-prevent na magkaroon pa ng further infection. Ang ating healthcare workers, sila yung nagfo-focus dun sa pagsugpo mismo kapag naapektuhan ka na. No, that's true, Doc, kasi isang malaking dapat nating ipaalala sa lahat ng ating viewers, the idea of physical distancing or at least getting the information or sharing the information, the correct information. Guys, fact check. you always have, you can share the correct information to all the people around you. Especially kunwari, doon tayo sa grocery and makita mo na baliktad yung pagkakasuot ng mask, then I believe that is it is polite naman na pwede mong sabihin na parang, ma'am, I think yung mask po natin para mas maging effective, dapat baliktad po yung pagkakasuot natin. Something like that. It is really a big help already to all the people around you. No? Now, Doc, ito po, speaking of being a team, now ito po yung team ng mismo mga frontliners natin sa loob ng ospital. Paano yung support po ng ating mga frontliners sa kanilang co-frontliners? Paano po nila maaalalayan yung mga co-frontliners po nila?
Okay, nabanggit nga ni Dr. Des kanina, no? And I'm sure it's happening everywhere else, no? Na sila mismo ang sa bawat isa, di ba? Papausap, no? At saka pag sinabi nila na naiintindihan ko yung what you're going through, talagang naiintindihan nila, di ba?
Kasi pareho kayo eh.
Tapos, merong isang proseso, no? Psychosocial processing yung tawag namin doon. It's a form of group therapy that we usually utilize to help people identify what are their immediate needs. And sila mismo ang nag-iisip kung paano solusyonan yung mga needs na yon. So, the psychiatrist or mental health worker, there is a mere facilitator of the process. So, during that group therapy, sila ang nagtutulungan sa bawat isa. So, you empower each one of them. So, yung sinasabi ko kanina na powerlessness, that is one of the reactions to a crisis such as this, nababawasan yun. Diba? Actually have the power to help yourself as well as help other people.
Ayan. So talagang that support system is highlighted, no? Now, Doc, actually medyo nabigyan na pong konting preview ni Doc Jimenez yung sagot dito sa question na to. But then I'd like you to elaborate more. Ano naman po yung pwede pong tulong ng ating hospital administrators or hospital officials sa ating mga frontliners? Parang may nasabi po si Doc Jimenez kanina na pinapastay po yung iba po nating mga frontliners in our emergency room or parang may lodging din po sila inside the hospital. Ano pa po yung pwedeng measures na maitulong ng ating hospital administrators?
So, tulad ng nabanggit din kanina, di ba? Yung provision for personal protective equipment, dapat hindi nila pinoproblema yon, no? Dapat hindi nila pinoproblema yung safety ng kanilang environment, whether at home or at work, no? Na-mention ko na kanina yung mga protocols that should be in place. And dapat ang mga hospitals, parang merong mga support system, no? Kasi merong mga na-employ ngayon ng mga nurses, halimbawa, na batang-bata na kag-graduate ng, na-employ sila sa mga critical areas. So they also feel at some point that they are inadequate, no? Na kahit na sila ay nakatapos, kahit na ilang buwan na silang nandun sa trabahong yun, merong inadequacy that comes into play, no? So yung mga supervisors nila ang nagtuturo sa kanila, kumbaga parang crash course, no? How to handle clinical situations such as this. And then isang important thing kasi na dapat hindi malimutan ng mga managers, no, is people management. Kasi pag ganitong mga crisis, kailangan natin na i-manage yung ating mga tao. Kailangan wag nating makalimutan yung psychosocial well-being ng ating mga empleyado, no? Talk with them, how are you? Nakakain ka na ba? Nakatulog ka ba? No? So kung kailangan halimbawa na merong mga changes sa shifting schedules nila, yung binanggit kanina ni Doktora na usap tayo, that was parang what I call a psychosocial support kamustahan, no? So, na-identify kami doon na need, nagli-liaise kami with people from administration, no? So, sinasabi namin doon sa empleyado, o sige, i-bring up namin sa HR yung concern mo yan. Or halimbawa, gusto nilang i-clarify kung ano yung protocol ng Hospital Infection Committee, no? So, kina-clarify namin yun sa hospital control infection control committee at tumabalik kami doon sa taong involved, no?
Oh.
So, doon kasama yun sa mga institutional support, no? Kasi minsan during an ordinary day you go through a lot of red tape, no?
Yes po.
Pupunta ka muna sa supervisor mo, yung supervisor mo pupunta sa supervisor. Tapos niya pupunta sa di ba? Dito sa Medical City, for example, merong very effective na mga Viber groups, no? Pag meron lang nag-message no, ng specific concern, whether it's a small concern or a big concern, no, na-address ka agad kasi people who are members of that group see it and they respond, no?
So real-time siya na nabibigyang solusyon.
Yeah, that is possible.
Sige, Doc. Bali, ito po, meron po tayong mga questions from our social media accounts. So ito po, galing po sa Facebook from Gabriel Garcia. Now, this is about supporting frontliner parents. Now, ang question niya po, actually her message is, hi, is it okay to tell my parents who are doctors working right now that I am constantly worrying about them? Or will it only add to their stress knowing that their children are experiencing anxiety? So should they, pwede ba nilang iparating yun sa kanilang frontliner parents? Or baka kasi masalo pang maratel yung ating frontliners pag ganun?
Oh, kasi minsan sinasabi natin na, siguro alam na nila yan. No? Pero, maliban dun sa advantage na nalalaman ng other person exactly how we feel, release para sa atin, pag nasabi natin dun sa other person, merong therapeutic effect yun no?
Yes.
Ventilate natin sa kanila kung ano yung ating mga fears, ano yung ating mga anxieties. So yeah, you can tell them that you are worried about them, and so they can tell you some reassuring words, no? They can tell you that they are also worried about being infected and infecting anybody else, and that issues. No?
Ayan. Okay. Now, Doc, ito naman po, second question po from Monica Harasabal, also from Facebook. How about for frontliners who already lost a loved one or immediate family to COVID-19 and still have to go back to work immediately? Siyempre kasi, duty calls. Now, what advice can we give them as they are dealing with anxiety, grief, and depression po?
Okay. Kasi everybody goes through a grief process, no? When you lose somebody, no? Kaya lang ang problema nga ngayon, parang hindi tayo masyadong nakakapag-grieve, no? Dahil wala tayong mga rituals, no?
Yes po.
Di ba? Kaya tayo nagkakaroon ng wake, 3 days, 5 days. Not for the purpose of the dead. It's actually for the purpose of... So, kasi it's a process na of us coping with that loss, no? Kaya na ang problema nga ngayon, hindi tayo makapag-grieve, no? So sometimes nga, lalo na kung may frontliner pa tayo, no? Nakakat short yung grieving process, no? So we should allow ourselves some time to heal, no? Of course, the Medical City Department of Psychiatry have also partnered with Emmaus group of counselors, and they will listen to you, no? They will help you process this grieving loss.
Okay, ayan. Maraming salamat po sa inyong insights, Dr. Batar. Ang dami po namin natutunan ngayon kung paano ba tayo susuporta sa ating mga frontliners, especially dun din sa ating mga viewers na frontliners themselves, kung paano ba sumuporta sa kapwa nila frontliner at sa mga loved ones nila to reassure them that they are also doing their part. So, Doc, meron po ba kayong mga final words para sa ating viewers or simpleng mga shout-out sa ating mga frontliners dyan?
Okay, shout out muna sa mga Medical City Department of Psychiatry, lalo na doon sa mga co-psychiatrists ko at mga psychologists na part ng aming mga support groups. No? They're doing a lot of work in terms of providing psychosocial support. As a final word, I'd like to talk about post-traumatic growth. Okay? Siyempre gusto na natin we end on a good note, di ba?
Yes.
Of course, may mga studies na ngayon telling us that we should anticipate that there will be a surge in the incidence of mental health conditions after this pandemic. No? But there's also a possibility that we will become better persons after this. No? And I think one way by which we can be better persons after this is if we find meaning in our suffering. No? If na-realize natin na meron palang mga changes na kailangan akong gawin sa aking buhay, na-realize ko na ito dahil dito sa nangyaring pandemic. No? I didn't do it. Diba? So finding meaning to suffering can actually start off a chain of improvements in our life, in our personhood.
Ayan. Maraming salamat po, Dr. Batar. Sobrang dami po naming natutunan ngayong hapong ito. And bukod po sa ating mga doktor at nurse, salamat din po sa mga bayaning medtech, radiotech, aides, utility at mga gwardya sa ating mga ospital. Binibigyan pugay din po namin ang ating mga frontliners sa checkpoints, mga police at militar, mga community health volunteers, mga nagtatrabaho sa botika, grocery at palengke, mga LGUs at barangay workers. At syempre, lahat ng mga nandyan na nanonood lamang at nagsistay sa kanilang mga sari-sariling bahay. Lahat tayo dito, frontliners na din. Or tayo din, magtutulungan para mairaos natin itong COVID-19. Muli ako po si Naiko Bautista from #MentalHealthPH, ang inyong host for today. See you mga champions, stay safe and let us recover together.